Hello, my name is Stephanie. I'm going to be your nurse this evening. How are you feeling?
I'm so tired. I can barely keep my eyes open.
Do you have a history of urinary tract or kidney problems such as surgery, infections, kidney stones, cancer, sensitive bladder? Have you had a pregnancy? Sexually transmitted disease? Have you been taking any antibiotics, muscle relaxants, medicines for neurologic or stomach problems? Have you been experiencing any urinary retention, urgency, frequency at night, burning during urination, nausea, vomiting, or chills?
I take Tylenol and he has birth control pills.
She's been really run down the past few days. I'm really worried about her. She's been in her bed with the covers over her head, not going to class, complaining that her back has been hurting. Actually, she's had a heating pad on it.
What do you mean? Has she had a fever over the last few days? Has she had any other complaints? Has she been eating and drinking?
She has had a fever. And in the past few weeks, she's been going to the bathroom a lot. She told me that it hurts to pee. We went to the Student Health Center and we got some pills from the drugstore. I can call her suite mate and get the name of the pills. Also, she's been eating only crackers and sips of water for the past 3 days. She's not gone to class or been outside.
Thank you for giving us that information. It's very important. Please do make that call and find out the name of the pills that Sarah got from the drugstore. I'm really concerned. She may have had this UTI for a few weeks or more based on what her roommate said. I think we should call the rapid response team. Based on our hospital's guidelines, she meets several criteria for activation of the rapid response team. Her blood pressure is low, heart rate is 130, respiratory rate is 30, and I'm concerned about her. Yes, could you please page rapid response team? I need them to come to room 221 right away. Yeah, thanks. Excuse me. Could you watch my patient in room 221 for a minute? I got blood on my shirt and have to change.
Oh, yeah.
Thanks. I'll be right back.
Hi, I'm Marie. Thanks for calling the rapid response team. What seems to be the situation?
Sarah Johnson in room 221 has low blood pressure. She's 19 years old and was admitted yesterday for a UTI on IV fluids and antibiotics. She may have had a UTI for 2 weeks or longer. BP 86/42, temp 101.8, respiratory rate 28, heart rate 130, pain with urination. I feel the patient may have severe sepsis and requires a higher level of care.
I agree. Dr. McCormick, should we screen the patient for severe sepsis, then order a lactating chemistries?
Yes.
Stephanie, please bolus a liter of normal saline. I will call the ICU triage physician. And Robert, will you go to the nurse's station and get a copy of the severe sepsis order set?
Yes, I'll get the severe sepsis order set.
Screen for sepsis. Sarah has screened positive for severe sepsis. She has a documented infection on antibiotics, meets all 4 of the SIRS criteria, and has new organ dysfunction, systolic pressure is below 90. Her urine culture has grown E. coli, but we don't have the sensitivity back yet. She's currently on Cipro. I think we should add ceftriaxone.
Oh, Marie, you mentioned a fluid bolus. Should I start that?
Yes, thank you, Stephanie. Let's give Sarah Johnson a liter of normal saline to infuse over 20 minutes. Dr. McCormick, did you want to order ceftriaxone 1 gram IV every 24 hours?
Yes.
Stephanie, please make sure that ceftriaxone is hung within the hour.
It's ceftriaxone hung within the hour.
I ordered a chemistry panel and a lactate, and yes, I'll order the ceftriaxone 1 gram IV every 24 hours, and once we get the sensitivity back, we can adjust our antibiotics.
I will facilitate her getting a bed and step down. Dr. McCormick, if you could put in the transfer orders and be sure to include the sepsis protocol.
That sounds good. I'll put in the transfer orders with the sepsis protocol.
Marie, Dr. McCormick, I need clarity.
Okay, Stephanie, what's going on?
I think that Sarah needs closer monitoring. I'm concerned that her BP is dropping too quickly, she's not responding to treatment, and she won't be monitored closely enough and step down. I would feel more comfortable moving her to an area with higher monitoring.
Actually, you're right about her blood pressure and her unresponsiveness to antibiotic and fluid therapy thus far. I agree. I feel comfortable moving her to the ICU. Dr. McCormick, what do you think?
I agree with Stephanie. I think it's a good idea.
I feel much better about that. And you'll come back to check on her?
Well, either Marie or I will.
So let's review the plan. I will facilitate her getting a bed in the ICU. Dr. McCormick, if you could put in the transfer orders and be sure to include ceftriaxone 1 gram IV every 24 hours and ciprofloxacin 400 milligrams every 12 hours.
That's ceftriaxone, 1 gram IV every 24 hours, and Cipro, 400 milligram IV every 12 hours.
Robert, can you make sure we have oxygen and emergency equipment available for transport to the ICU?
Yes, that's oxygen for transport and emergency equipment.
Yes. Stephanie, has the patient finished her fluid bolus? What are her vital signs?
Heart rate is 110, respiratory rate is 24, and BP is 90/48.
Please administer another liter of normal saline IV over the next 20 minutes.
It's normal saline IV over the next 20 minutes. And when do you come back to see her?
Good question. Dr. McCormick and I will be back to see her in an hour. If you have any concerns about her or if she gets worse before then, please call us.
She had her temp 100, her BP was up. Oh, hi. She seems much better. Her color's pink, her BP's 110/68, temperature's 100, heart rate is 86, the respiratory rate is 16. She's less lethargic and her color's better.
That's great. Has Dr. McCormick been back to see her looking more comfortable?
No, I haven't seen her since we moved to the ICU.
Well, let's quickly go over the rapid response call. Thanks, Stephanie, for being worried about Sarah and calling rapid response. Also, thanks for speaking up about moving her over to ICU.
Thank you, Marie. And Robert, thank you for being so efficient in getting Sarah over to the ICU.
Thanks. I think the call went well.
I'll page Dr. McCormick to remind her to come to follow up. Dr. McCormick, have you had a chance to follow up with Sarah? I just re-examined her and she looks much better. Thanks for coming to the rapid response call to participate in her care. Please come take a look at her so you can sign out her improved status to your day team before you go home. Okay, thanks. Bye-bye.